Cannabis is different from other medicines for a variety of reasons. Cannabis can be seen as a broad spectrum therapy, which means it can work on many disease states and conditions throughout the body. And that's because the endocannabinoid system is located throughout the body. Unlike other medications, it often has stronger therapeutic effects at lower doses. And most important, cannabis medicine is individualized. To get the most out of cannabis, we need to find the dose that's right for you. However, keep in mind, cannabis has a wide therapeutic dosing range, which means that some patients may need very little to achieve benefits while others need much more. So if you're inexperienced, there may be some trial and error involved, but that's okay. If you do experience any unwanted side effects or adverse reactions, they're all temporary. Also, I'm going to provide you with some tips, tricks, and cheat codes along the way so we can avoid all those things and have a pleasant experience while navigating through cannabis. Cannabis initiation in new patients is always start low, go slow, and increase slowly. This is a must that's often overlooked. Regardless of your experience with cannabis, I think everybody should apply this method at least in the beginning. Also, medical cannabis may be stronger than what you're used to. This is not the stuff that you had back in the day. Regardless, it's always better to start off low than it is to just start off at 100. So what does start low, go slow even mean? Well, there isn't really a real definition of what that means, but here are some general things that I like to do. Always start sub-therapeutic. That means start with a dose that doesn't work, and then methodically increase the dose every other day until you find symptom control without any adverse events. For example, we would start off with a high THC containing preparation, but with a very low starting dose. So for instance, 2 milligrams tincture under the tongue, 45 minutes, 30 minutes before sleep. If you don't feel anything, that's okay. The next night, increase by 1 milligram. You do this every other night until effects are achieved. If you happen to wake up in the morning a little too groggy the next day, then all you have to do is pull it back 1 milligram. You pull this back until you wake up feeling refreshed, but you still have symptom control at night. That's the sweet spot. You still achieve benefits, but you wake up the next day beautiful. This is called finding the minimal effective dose. You also prevent any side effects from occurring, and you avoid building a tolerance. I also recommend combining CBD with THC when first starting out, as CBD will lessen the side effect burden of THC even more. So there are products at the dispensary known as ratio or blended products that contain a variety of CBD to THC ratios. And depending on the ratio of CBD to THC, you can pick your strength, if you will. If you don't want any psychoactivity, I would start with a CBD 4, THC 1, or at least if the CBD is 4 or more and the THC remains 1, you are clear of psychoactivity. If you start off at a 1-to-1, which is the first one that we physiologically respond to, so relatively it is the lightest compared to everything else besides the 4-to-1s and up. This is always a good place to start if you're not sure. You can work your way up or down from here, but at least you know. Take a look here at the cheat sheet that I provide all the new patients when first starting out with cannabis. Pause it, take a look, and it will be in the description below as well.